Big Money Bound TV, RRT Posse, YouTube. If you're new to the channel, please like, subscribe, and turn on post notifications. I release scheduled videos every Monday, 12 o'clock a.m. Eastern Time. But I also release some unscheduled videos throughout the week. Now, if you're returning, hey, welcome back. I appreciate all of the support, man. Thank you. Now, hey, dog. What we represent, man?
Big Money Bound.
Say, let her know, man.
Big Money Bound.
Last night wasn't bad compared to all my other nights prior to last night. Like the last 2 nights prior, we have been like the respiratory therapy department has been super busy, man. When I say busy, on a normal night, the most vent have like the most. You feel me? Y'all know I gotta have my water now. If you know, you know now. But the most vents you'll have on a night, the most, is 8. And that's extreme too much. Bro, the last 2 nights, I'm starting off with 11 or more vents. I ain't gonna say the next one, I'm just gonna say or more. I'm starting with 11, ending with 15. How did I take care of 15 vents, bro? How? I'm asking y'all because I don't remember. I'm still dizzy. How did I do it? How did I do that? I don't know because I'm still dizzy. Dog, and y'all know me, man. Like, bro, I got one speed. Like, I got one speed. I can't be no, hey. I got anxiety problems, dog. I got anxiety problems. I've been on pass. I got anxiety, bro. I've been on drop then, dog. I've been became a patient. I can't do that, dog. Hey, I got one speed, baby. Did I see everybody? I seen everybody. I'm only human. I'm gonna leave it at that. I'm only human. That's all I'm gonna say. But last night I started off with how many events I had? 4 events. I started off with 4. I ended with 6. My 5th vent, there was a cold blue on the floors. I'm sure y'all probably know what cold blue is, but if you don't, cold blue, cardiac arrest, patient heart stop, the breathing gonna stop. They perform CPR, get the heart rate back, then they intubate. So that's the situation that took place. They intubated the patient, then the patient came up to me. So they was calling me saying, we coming up to your floor with a ventilator. The patient needs a ventilator, so set up the vent until we get there. So they come in there. I got the vent all set up. They bagging. You know, everything seemed good. Okay, cool. So I'm trying to get report, yada, yada. Okay. I put the patient on the vent. All right, kind of ventilating. Okay, cool. Now everybody leave now. The therapist that gave me the report, they left. And it's just me and the nurse in the room. All right. So we hearing like, you just hear like gurgling noise just coming up, like air just coming up. Normally when that happens, you gotta just inflate the cuff a little bit. So knowing that, I've been here before, let's inflate the cuff. Inflate the cuff. It don't stop. I check the cuff pressure. It's not inflated. What the hell? I do it again. Not inflated. Air still coming up. So I called the therapist. I'm like, hey, man, did y'all check the ET tube, the pilot balloon that was on the tube? Did y'all check the cuff? Yeah, everything was good. It was intubated. There was no problems. I'm like, all right. And that's why it's extremely important to always, man, no matter like how in a hurry you is to intubate somebody, you got to do your pre-check techniques that you learn in school, man. They always say, check the cuff on the ET tube before you intubate. Inflate it and squeeze it. Make sure it ain't no. What do I want to say, bro? It ain't no defects. I was gonna say deformities. But I guess that would be right. Make sure that the balloon has no defects. So there could be a hole in it. You don't know. I ain't saying that they didn't do that because they're saying they did. But what I'm saying was the cuff was deflated and it wasn't inflating. It was some defects to it. Something wasn't right. So I can't just snatch the tube out and go to ambulance. That would be, why you ain't do that? Like, you gotta like notify the doctor and let them come take a look at it, because they may feel like, oh, ain't nothing wrong. Now, you don't extubate somebody for no reason. Now, you in trouble because they got to re-intubate. Bro, all I do is, hey, man, respiratory therapy is how I eat. That's how I get my fetty. Big money bound TV. Nothing gonna interfere with my money. So, anything that's kind of like, well, this may happen to my license. But I ain't, hey, doc, I need you over here ASAP. Doc ain't answering. I went over there and I got the resident. Hey, dog, I need you to come check this patient out, or something. You got to re-intubate. The doctor came over there. I'm like, hey, you can hear the noise. You see the vent. No tidal volume is moving. The chest is not rising, bro. We got to take this tube out and ambu bag. The doctor said, all right, hold on. Give me a blade and let me check to see if it's in the right spot. Hey, that's the right thing to do. Before I take something out, let me check. You feel me? That's why I didn't just yank it out. You can't just go in there, hey, it ain't in the right place, let me yank it out. No, don't, hey, bro, don't do that, dog. I know somebody that did that. Yeah, I know somebody that did that, dog. They extubated the patient, took it out. Couldn't nobody get it back in. What happened after that? Yeah, that's all I'm gonna say, dog. That's all I'm gonna say now. If you want to hear more, drop them comments and I got you, dog. But hey, they couldn't get that thing back in, man. That's all I'm saying. You gotta be careful, dog. Hey. So the doctor like, yeah, man, the cuff is like deflated, so we gotta re-intubate. So we extubated then we start the ambu bag. Whenever you ambu and you bagging, if you squeeze the bag, you squeeze the ambu bag, and the bag that's on the end of that, it deflates, you gotta put more flow up, bro. That should not be deflating when you squeeze this, because that's where the air is coming through from. It's coming through from over there. So if you deflate, if it's deflating when you squeezing, they're not getting 100%. You feel me? The only reason I know this is because when I was a student, I was working in ER with a therapist who was precepting me, and we had to intubate somebody. And I was bagging like that, and one air going through. The dude told me, hey, man, anytime that you intubate somebody, you got to make sure the ambu bag has enough flow. You feel me? He turned it up and cranked it up until it didn't deflate anymore. So I learned that in the field. I ain't learned that from no book. I ain't learned that from no schoolhouse. This is what you learn in the field. And just so happened, I taught that dude something that same day. We had a patient that was on a cool aerosol mask. Anybody who know how that works, you get a cool aerosol mask. It's like a water cooler that's hooked up to it. As the air is flowing by, it's blowing out a mist. So to get like an FiO2 of 50 liters, 50% with the cool aerosol mask, you got to put it at like 12 liters. And it says how many liters on the back. So he was like, the preceptor told me, hey man, put this guy on 60%. I'm like, all right, no problem. I turned it to 60%. And I checked the back of it to see how many liters I got to go up. I'm like, all right, let me go to 12 liters. He like, how you know to go to 12 liters? I'm like, it says on the back of the bottle. He's like, dang, I never knew that. I just turn it up until I see the mist coming out of the tube. Hey, we both learned something that same day. So, bro, it's like, in that field, you're going to learn a lot as you grow, bro. And I was a student. The dude had been a therapist for like 10 plus years. That's why, like, I never get in my head that, like, I know it all. I can't learn something, bro. When you do that, dog, you're in trouble, bro. Especially taking care of patients. Don't never do that. You can feel like you know 95% of what you need to know, but still know you got 5% room to grow. You feel me? And speaking of that room to grow, I'm drawing ABGs. I get an ABG. They call it rapid response. I draw an ABG. The monitor is saying patient at 85%, 84%. They saying we need to put them on BiPAP, all this, all that. The patient in bed vibing like this here, man. Patient in bed just chilling. I'm like, don't really need no BiPAP, but let me go get this ABG and let's see what it is. So I run the ABG. I get the values back. pH normal. CO2, it's like 35 or 30. It wasn't too crazy, so it was within normal range. The saturation is like 95. The patient needs nothing but to be left alone, man. That's it. So I bring the values back to the doctor. The nurse like, you didn't bring the BiPAP? I'm like, the patient doesn't need BiPAP. But it sats 84%. Hey. I just ran the blood gas. I got a saturation back from a cellular level, from the blood. The patient's blood is oxygenated. Like, this machine is not working. This is wrong. But it's I know what it's saying, dog. But listen to what I'm saying, man. Like, bro, the patient is doing good. Same thing again, another ABG. I'm like, all right, man. Patient in room air. I draw the ABG. Patient pH is like 745, and the CO2 is on like 29, 28. So what we in? We're in respiratory alkalosis. Patient hyperventilating. Why are they breathing so fast then? Because the PO2 was like 58, 59. The saturation was 89. I go back, I tell the nurse, hey man, we gotta put this patient on like some oxygen, like 3 liters, 30%, 35%, 40% Venturi mask. She like, why would I do that? The patient's at 100%. Bro, if you don't get out my face talking about that monitor, bro, I just got some blood, man. This is the cellular level. This is more accurate than anything in here, bro. This is the blood. This is the blood, dog. So she's like, all right, no problem. I'll put him on some oxygen. Okay, cool. I got another ABG, dog. Lady gonna tell. Like, hey, man. Respiratory therapy, dog, you gotta understand ABGs. Like, that is a huge part. Understanding ABGs and fixing them. I know I say that time and time again, but I can't stress it enough because that's what respiratory therapy is all about. I run a blood gas, man. This is, what was it, man? Man, let me think. Hold on, let me think. I had a long night. Hold on. Let me think.
It was like, fully, what was that?
Fully compensated respiratory alkalosis. That's what it was. It was alkalosis. It was like 7.43, which is it's still within normal range. It's fully compensated. So the bicarb was low. The nurse gonna tell me the ABG is bad. It's bad. The bicarb low. No, like, hey, bro, like it's being compensated. You feel me? It's being like fully compensated. You feel me? The bicarb dropped low to compensate for the high alkalosis. Hey, man, I'm sleepy, dog. That lady like, no, it's bad. I'm like, all right, dog. You can't argue with no therapist about no ABG, dog. That's all I'm saying, man. That's all I'm saying, dog. It went acidotic to bring that pH within, you feel me? Because if that bicarb wasn't acidotic, that dude would be so alkalotic that it's crazy, you feel me? It was still on the alkalotic side, but within normal range. Hey, dog. Respiratory therapy, man. Y'all feel me? Y'all make it happen, dog. It's possible, dog. School is key. Shout out to all the therapists that's in school, first year, second year, last semester, whatever you in, dog. Hey, it's possible, dog. Hey, all I did was go to school, man. That was it, dog.